Well, you are joining us today at Red Hill Orthodontics, and we are here with Dr. Sam. Now, we've been to the other location, but this time we're on Upper James, and we're talking about why come to Red Hill, what kind of services they offer here, and I know that, Dr. Sam, you guys are unique in many ways. Tell us a little bit about the clinic.
Well, as you can see, the clinic is welcoming to all patients, and we have like an open concept where we treat everybody bustling and busy, and we treat everybody like a family basically here. Actually, we all know each other, and usually our hygienists see the same patient over the treatment, throughout the treatment, and so we have to keep it more intimate and close relationship between the hygienist and me and the patient as well. So we treat those patients all in like a family business, basically family oriented, and we really in our clinic rely quite a bit on the highest technology that are available in the market. So we do the Invisalign. A lot of people do the Invisalign, and we just really focus on trying to achieving the result and showing the patient basically what to expect from the treatment. So this is basically you can see here how his patient's teeth. He's been in treatment for almost 2 years now and getting close to the end. But you can see the movement of the teeth here. What we're doing in this case here, we're trying to open the bite a little bit for the patients and have him wear some elastics basically to coordinate the bite and coordinate the midline of the teeth as well. So that's what really we're hoping to achieve here, and we're closing some spaces in the back as well. So this visual effect that we have is just added value to the patients to see what exactly we're doing here.
Absolutely.
And help them understand the mechanics and what exactly those elastics are doing and why this is taking that much time of a treatment. So that really helps as well.
Well, it certainly is a beautiful, very welcoming office that you have here. And coming up, we are going to be talking a little bit more about Invisalign. We'll be talking about adults that get braces. We'll be talking about kids that get adult braces, braces, not adult braces. We'll talk about both coming up. Lots more to discuss on Morning Live. Well, we are back here at Red Hill, and there are a lot of different components that go into giving you the perfect smile, because of course, Dr. Sam, people's smile is quite often the first impression to people.
Absolutely.
So tell us what's going on here.
So this is what the consultation will start with. So we start, after greeting the patients, we do the 3D scan for him.
Okay.
So we have Max here, and he agreed to be on camera with us here today, and we're going to just do his consultation. So we're going to take a 3D imaging for his teeth. So you can see here with that really high advanced camera that can take a scan for the whole mouth, even for the roof of the mouth. We get to really imaging, like three-dimensional imaging for the teeth.
Yeah, that's super cool.
Yeah, it's really cool. I'll show you that.
It's amazing what technology can do.
It's good? Yeah. Okay, so you can get, after we scan the upper and lower, and then we do this. So you can see now, but the bite doesn't know, so we ask the patient to bite. And then we do the scan while the patient biting to get really the actual bite for the patient and have accurate reading, and so an accurate diagnosis basically for his bite.
Yeah.
So when we do the consultation, I have a pretty good,
idea of what he's going to need.
Exactly, and pretty good visual also tool to show the patients what a bite looks like now and how it's going to look after fixing.
So you can kind of show a before and after with these scans then.
Absolutely.
So you take the scans, comes in, it's totally painless, it's easy. This is all part of the consultation.
It's super easy. It takes literally like less than
that took like 5 minutes. Yeah, it's nothing.
2-3 minutes, and it's not. Back in the days, we used to take molds and impressions for the patient.
I was just about to say, what did we used to do back in the days? Because I never had braces, so I don't know.
Yeah, we used to take just actual molds.
Okay.
And then take a 3D, pour those molds, and we have like a 3 models basically for the teeth.
Yeah.
Now we don't need to do that. We just do scan, no need for impression. It takes 2 minutes, as you can see.
Okay.
It doesn't make the patient gags or anything, because it's just an intraoral camera, almost like a pen size.
Yeah.
You put it there, and then you scan all the teeth, and done. That's it. Even if we're going to do any appliances or any treatment, we can do it off the scan itself, actually.
Really?
Which just makes it easier as well, so no need for impressions anymore, ever.
Oh, that's amazing.
Yeah, it's pretty cool, actually.
Now, is this kind of widespread in all dentistry right now, or is this kind of specific to something you guys do?
No, it is actually becoming more popular these days. It's definitely not all offices, they still offer this, but we're pretty much really trying to be more advanced in our technology, basically, and up to the standard, basically, or higher than but like it is quite popular now.
Okay.
Yeah.
All right. Well, coming up, we are going to be talking about braces or Invisalign, which is best for you. And of course, they do have a huge list of kids that come in here to get their braces put on, taken off, treated. We'll discuss
show, like,
that
how
coming
you can
up.
play there with that, so you can show the patients how the bite looks like right now.
Oh, yes. Okay.
And
Lots more coming up on Morning Live. Back here at Red Hill Orthodontics, and we're in the consultation process. So we've gotten the scan done, and then we come into the office with Dr. Sam, and this is where you kind of go over everything with the patient and let them know what would be the best options for them.
Absolutely. So after the scan that you guys seen already, so we put the pictures up, we upload the pictures up with the scan up on the screen, and now we have a visual model here to show the patients what his bite looks like and what we're really anticipating to do and how exactly we're going to do it. So in this case, for instance, for Max, we have, this is his teeth from the front. We have a little bit of open bite here between top and bottom teeth. They don't touch on both sides and in the front as well. So we're going to try, and we can see here, this is the lower model of his teeth here. We're looking really straight at them. You can see he has some spacing between his teeth, so part of the objective of his treatment will be closing spaces and closing the bite as well.
Okay.
The top also looks a little bit of a spacing, a little bit of alignment could be accomplished as well. So
He's got pretty good teeth though.
Yeah, he's got really good teeth overall.
Yeah.
I think mainly he's looking to close spaces and close the bite
And close
as
the
well.
bite.
So that's what the first models that we're looking at. I'm going to show you maybe in a 3D here how things will look. I can change this to more like a teeth models like that.
Oh yeah.
And then you can see here the spacing between his teeth, and you can see the bite, how it looks like, how open it is.
Yeah,
and
for sure.
So a lot of time patients can't see the back teeth, and they don't understand what exactly their bite looks like. They mainly focus on the front teeth and the alignment and the spacing.
That's all we can see, right?
But this is really helps us to really show the patient how his bite exactly looks like in the back, and how really improving it, how it's going to improve his bite and his chewing ability. So that's really good visual effects basically to show the patient how the bite looks like in the back.
Okay, now would you recommend something like Invisalign for this patient?
Absolutely. So this is what the advanced technology of Invisalign has, that service where they show before and after. So this is what his bite right now, and this is really our objective where to get to.
Yeah.
And that's really good also to show the patient what really his teeth would look like. We have also a technology now, AI technology, to show even if we take the actual patient's face and smile, we can show how the smile looks on on their face. Yeah.
Wow.
It's really quite really advanced now. So I didn't take here the actual pictures for the face, but if we had taken the smile photo, I can show how the teeth will look like in the actual smile's face.
Wow, that's a good way to sell it for sure.
It's really neat actually. People say, okay, how my teeth will look like? How do I look like after treatment? We have a tool now to show the patient how would they look like in the end. So for this patient, actually, you can see how the bite close up before and after. We close in the spaces, and that now patient have an expectation or something to really think about. Is like, okay, if I do treatment, this is what I'm going to get. I'm going to get better bite in the back.
Yeah.
I'm going to get improved bite in the front and closing spaces between my teeth.
All right, well, that is some cool technology. Coming up, we are going to be talking about kids and how they do get braces, starting at what age, going to what age, and then how it transitions into adult braces, because about 20% of their patients are adults that do get braces. So all of that and more coming up on Morning Live. Well, it's not only adults that get braces, of course, lots of children get braces, or I guess, Sam, I should probably say that in reverse, right? It's not just kids that get braces, adults get braces
Absolutely.
too.
So once the patient decided to go ahead with treatments, actually we have different tools that we use. Whether adults or kids, they can have any of those tools. So we have the easiest common option as well these days is the Invisalign, which is a series of trays that fit their teeth and take their teeth from one point to another point by moving them little by little. Every tray will move the teeth slightly. So they have a series of trays, let's say 20 trays. Every tray will move the tooth a little bit until we get to tray 20 to achieve the result.
And how long does it normally take?
It depends on the type of movement that you're trying to do and what exactly you're trying to achieve. But typical treatment will be between year and a half to 2 years.
Right, that's what I was going to suggest.
So this is the Invisalign. The advantage of the Invisalign, again, teenage do have those, and adults as well tend to lean toward Invisalign. The advantage of it is that you can take it out and you can have freedom to brush and clean your teeth and eat without nothing on your teeth. And then when you're done, you brush and you put it back on to continue your treatment, basically.
Yeah, that's cool.
So it's a really neat,
Easy.
well, the issue with that one is compliance, as you know, probably.
Yeah,
So
I don't feel like putting them in. I don't want to do it.
No, a lot of young kids are like, oh, I can't keep a track. I'm wearing
I
aligners.
lost it. I don't know where it is.
So we go for more the traditional braces, or actually we have those clear braces as well as an option.
So funny, braces have come so far. Like I remember a lot of my friends when we were teenagers had braces, and they were so big and so clunky. They took up almost their whole tooth. But now it is such a big difference. They're so small.
They are small. They are custom made sometimes. There are different kind of braces that we use, but they're really custom to the patients in the sense that they fit exactly on the tooth where they should be. And we just put sometimes colors on those braces to make it more fun for the kids.
Totally, yeah. They can pick their color of elastics.
It is, believe it or not. I mean, you would think clear braces will be the first option for kids. They usually like the metal braces because they can play with the colors and they like the metal on their teeth.
Yeah.
So that's what really we do for them. We put those braces and different kind of colors to make it more fun for the kids. And those braces tend to move the teeth to get the desired result that we need to achieve.
And that's, again, potentially a year and a half up to 2 years.
100%.
And then, of course, you have to wear your retainer. Don't forget. That's really important.
So when we're done and we got the teeth where we want them to be, we usually give the retainers. There are two kind of retainers. There's sometimes a wire behind the teeth that goes. You can't see that wire, and you get used to the feeling of it. It's really smooth, and you got a little bit of bonding on it, so it's not that bulky. And we give them a nighttime retainer on top of it just to warranty everything. So if the wire comes off, you have something to hold the teeth where they should be.
Very cool. Okay, so it's a really simple process here at Red Hill. You just come on in, see Dr. Sam and his team, really friendly, really welcoming. They'll sit you down, they'll give you a consultation, and you can have the best smile that you know how to have. Lots more coming up. Stay with us.